Assalamu alaikum warahmatullahi wabarakatuh. Hello everyone. Hope you all are fine. I am Dr. Moenes. I am a doctor I'm a lecturer of internal medicine at an university, Egypt. I have MD and MRCPUK. We are here to talk about communication skills basics. So, for MRCPUK basis candidates, you will have two stations. In these two stations, you will have 5 minutes before you enter the room. In these 5 minutes, they will give you a paper in the scenario and a white paper and pen and pencil to write your notes. Then you will enter the room and spend 10 minutes with the surrogate. After 8 minutes, they will remind you that you have 2 minutes. So, what is this communication about? Well, this is a way that you can talk with the patient in UK, that you can communicate with him, talk with him, and you can discuss with him all the important information regarding his condition or the problems that you face with him. And the most important that you don't make a trouble with this. This is the important thing. So when you will have this 5 minutes, they will give you, like I said, paper with a scenario. What I should do now? First, you need to read your scenario carefully. What I mean that you will be in stress. You will have a long scenario, so you may have difficulty in reading it from the first time. So it's not an issue to read it again. Okay. After this, you need to write the name of the patient, okay, and his age. It's better to if it's written for you the name of the patient to just confirm with him by his name, not just to say I'd like to confirm your name and age, please. It's better to say his name. That will make a good point for the examiners and for the patient also. Then you will write your role. You are just the doctor in the clinic. You are the doctor in the ICU. You are the doctor in the ward. Okay, because you need to understand what is your role here, and to know what is your limitation. And when you involve a multidisciplinary team, don't involve yourself again. Then you write, summarize the scenario, do important points. Why? Because you may miss one point or another. Okay, and when you do this, you will may miss a point in your communication, because one of the points that they judge on you is to mention all the important point. Don't miss anyone. So I will make a summary for the scenario. I will write this patient, Mr. Ahmed Ali, 60 years old. I am the chest doctor in the clinic. Then he come by chest pain. Then he developed dyspnea. Then he developed whatever. Then he did PCI. Then he deteriorates. Then he go to ICU, resuscitated, die, whatever. Okay, so I mention it in points. So don't forget anything when I get with the surrogate. And then I will write my approach, how I'll approach this case. What is this case about? Is it a diagnosis? Is it a medication? Is it a procedures? I don't know. So I will write my approach. How we will write approach, I will discuss later. Okay, but until now, I just do this in my white paper, write all these things. And after you write this, I need you to prepare yourself. Okay, you are now an actor. You will enter a station and you will talk with someone who is an actor also, and you need to believe this scenario. You need to act very well, because you now have the producer and the directors, and they are just assessing you. You to know that you can fit with the role, or they will search for another one. Okay, so you need to act very well. And the second thing, to act very well, you need to feel that the surrogate is not a surrogate. He is a real patient. He is a real relative. Okay, so you can have this empathy and sympathy with him. Your the way of tone of your voice, the way you act, the way your face look. All of this is important, and they are just here to look and see if you can perform this act very well or a little. This is the main issue of communication. And believe the scenario. I mean what? I mean when you read your scenario, believe it. It's true. Okay? They will not giving you information and then they will change it inside. I mean, if your scenario is saying something that you think it's not logic, how it could be, no, this is your scenario. They did this. So stick with your scenario. If you think that as a patient he has like chest pain, but the consultant he decided that it's psychic, okay, but he didn't give you any information in the scenario. Did he did ECG? Did he did anything? I don't know. But the consultant think he is psychic, so he is psychic. I will not tell the surrogate that it may be something else, but I don't know. I am not sure about that the consultant is right. No, you need to believe the scenario and don't invent anything out of the scenario, like this scenario. He may do some investigations. They didn't mention that he did echo, for example. Okay, but because the consultant decided he is psychic, it must be have all done all of this ECG, echo, maybe stress test even. Okay, but it didn't. They didn't mention it in the scenario, so don't invent it. You don't know it, so don't tell they did your echo. No, if they did investigation, so we did you for you investigation. If they mention the investigation for you, say it. Okay? Okay. Then while you enter, what the examiner want from you? They want from you a person that can communicate with the patient. He can talk with him with easy language, okay? But the most important is what? They want a safe doctor. They want a doctor that will not harm the patient. If he doesn't know anything, he will say, I will consult my senior. I will ask my consultant, not just to tell him any wrong information, especially if it's life saving. Okay, and if you see that he is like medical error scenario, they give him wrong medication, you need to stop this medication. Like he is hemorrhagic, brain hemorrhage, and he is on oral anticoagulant. You will not wait for the cardiologist to stop the anticoagulant. No, you will stop the anticoagulant. Okay, so be safe and be honest. Whatever I say, I don't know something, I will say I don't know. If there is any error, I will say this is a mistake. And know your limitation. What I know is the scenario tell me. I will not invent anything else. And also, if there is something is not my specialty, I will not talk to it in details. He will need for cardiac assessment. He will need for surgery. He will need for another specialty. So I may give him the broad line of this, but I will refer for the specialist. We will make a multidisciplinary team involve all these specialists. Okay. And the last but least, and the most important thing, to be a human being. I mean the empathy, sympathy with the patient. You need to communicate with patient. You need to be very empathetic and sympathetic with him according to the situation. Okay, so this is the main issue, really. The communication station. When we will discuss later, you will find they will mark you on a lot of like four items. Okay, but believe me, the main issue in this communication is that you can communicate with the patient. If you can communicate perfectly with the patient, they can, you know, um, they will um, um, they will pass anything wrong. Okay, and even if you have a problem in the clinical judgment, you will may decrease one or two marks, but you will not lose the station. But if you inform the patient with all the information and it was the right information, but you communicate with him with the wrong way, you will lose the station, even if your information is right. Okay. So the other thing that I will just use the simple language. Simple language, we mean the layman terms. How I should know about this? Well, there are some websites that you can read about any disease with for the patient, not for the doctors. Okay, the most important is the NHS. I found it. It's great in any search for for any disease, any condition. It's very simple and easy to search on it. And there are other sites. It's present in my Telegram group, and I will provide it in the WhatsApp group. Okay, then don't use jargon. It means don't use the medical terms. Use the terms that used for the patient. Okay, how I know with these websites that we mentioned. Okay, sourcing. Don't develop speech diary. What I mean with this? I will go with the surrogate. I will greet him, make introduction, and then I will start to explain like anything I want to speak about. And my task to explain for the disease, what is the symptoms, complication, and what was the management plan. Asking about his social, his job, his smoking, his alcohol. So I will just speak. No, you need to speak and get him to react with you. Speak and react. So after I finish one task like explanation, I explain the disease, the symptoms, the complications, the pathophysiology of the disease. Now, are you with me? Do you follow me? Do you get me? So he will start to interact with you because the circuit has a task. He need to finish his task. He need to just say telling you some information in the start, and then he has like two, three, four concern. So you need to interact with him to get him check his understanding and that he is following you, and he may give you one or two concern. Okay, okay. When he give you concern, do listen, not hear. Listen to him. I mean, you concentrate with him. Why? Because you have 4 marks on the concern. You need to listen to him because to understand what is his concern, and sometimes the surrogate may give you more than one concern in just one. He may give you one or two or three questions. Okay, so if you are not listening to him, you will may miss one concern or two, and you may not respond to his concern or answer his concern correctly, and you will lose here the concern, all the concern. Okay, so why you most of people are not listening? Because they are worried. I have task, I didn't finish it. Okay, he is now thinking about, okay, I have now explained the disease, so I want to ask him about his job and smoking alcohol, and then I will go to the management plan. So he was thinking about what he is want or he is wanting. That's why he is not listening. How I solve this? By as I said in the first, write your paper from outside very well. Your approach is written, so you just tick on it, and you are not bothering yourself or your mind now by all the tasks, or I am afraid to forget something. Okay. uh, then when the patient is talking, do not interrupt him. Never interrupt him. Let him speak until he finish. Okay, what if the patient is angry patient, or he is, he acts very bad, and I can't speak with him. Okay, try to apologize for him, or sorry, not apologize. Try to be empathy with him and show your sympathy. Okay, he is still not he is not he is not cooperative with me. Okay, if he is still and insist on this, you can, if you think this is not a suitable time to talk, we can postpone it. Okay, so the surrogate now need to stop. He will stop and we will let you to finish your task. Okay, I will tell the patient, will not interrupt him, I listen to him, then don't confront with him. I mean, the patient, you will may find this angry patient, this refusal patient, he refused something, he don't think that you are a good team. Whatever is the issue you will face, don't confront with him. No, I will not tell him, no, it's our right, we will not give you this medication, you don't have this right. No, no, no. Even anything, when we discuss more in the communication, don't confront with him. Try to convince him with this, showing him the advantage, disadvantage, and this is maybe risk for you, this is maybe benefit for you, whatever it. So try to convince him. If you fail, you will refer to the consultant, okay? But don't fight with the patient. And the most important, don't panic. Don't panic when you face an angry patient, tearing patient, crying. Don't be panicked. Don't be just confused how to deal with this. Just take a deep breath and show this empathy with him and do your task. Don't panic when you face any new situation, any new concern. Okay, it's not this. This is not the problem. This is not the issue. If you have in even new situation, new scenario, new concern, just take a deep breath and try to think what I should do or answer this. Even as I told you, even if you don't know this concern, of you afraid that I don't know this information, okay, but I communicate with the patient, so he may deduct 1 or 2 marks according to his judgment. Okay, but I will not lose the stage. So don't be panic, because if you panic, you will just, you will just like hitting everything around you. Okay, okay. Let's talk about this approach. We agreed that outside I'll have this 5 minutes. I'm reading the scenario. After the scenario, I write my name. I write the patient's name, his age, and I write my rule. Then I summarize the important information, and now I write my approach. What is my approach? In any communication scenario, you have three, let's say, four main steps. What is this? Introduction, explanation, what we call like just sad or just sad. I will explain now, and the management. What is this? First, the introduction. What is the introduction? Introduction that I say, hello, I am Dr. Muhammad, the doctor in the clinic today. I am Dr. Muhammad, I am the doctor in the ward today. Hello, I am not preferring good morning, good evening, because you may get confused sometimes. The candidate is, in stress. He may say good morning and he is now good afternoon. So the surrogate may say to him, no, doctor, it's good afternoon, and you just get, a block. No, we keep it simple. Hello. Hello, I am Dr. Muhammad. Of course, because of the UK, we present with the third name, the family name. I am Dr. Muhammad. I am the doctor in my room. I am the doctor in the clinic. I am the doctor in the ward. I am the doctor in the intensive care unit. Whatever. Am I talking to Mr. Ahmed Ali, 65 years old? Okay. I have to confirm at least two identity. Yeah. I mean, I don't. I can I'm talking to Mr. Ahmed. No, it's Mr. Ahmed Ali, or Mr. Ahmed Ali, 25 years old. And if I am talking to a relative, I need to confirm his relation. Am I talking to Mr. Sami, son of Mr. Ahmed, son of Mr. Ahmed Ali, 65 years old? Yes, doctor. Are you a next of kin? What is the next of kin? The person who is taking care of him or is responsible for this patient. Okay. So I will look again. Hello, I am Dr. Muhammad. I am the doctor in the clinic today. Am I talking to Mr. Ahmed Ali, 65 years old? Yes, doctor. Am I talking to Mr. Sami, son of Mr. Ahmed Ali, 65 years old? Yes, doctor. Are you the next of kin? Yes, doctor. Okay, and then we will take the permission. Okay, we are here to talk about your health condition. Is it okay with you? Yes, doctor. We are here to talk about your father's health condition. Is it okay with you? Yes, doctor. Here, because we are talking about his father's health condition, we need to be sure that he, his son, and we already take the permission from the father, because this is the confidentiality. The patient, you need to discuss his health issue with him alone, and to discuss with others, you need to take his permission. Okay, so if I'm talking to the patient, I'll say, hello, we are here to talk about your health condition. Is it okay with you? Yes, doctor. Hello, we are here to talk about your father's health condition. Is it okay with you? Yes, doctor. I assume that you already have taken the permission from your father? Yes, doctor. If the surrogate tell you yes, doctor, you will not, make him think that he is lying. No. Here he tell you always the truth. Okay, then we have something called ICE. What is this ICE? Idea, expectation, and concern. Idea, I mean, I ask the patient or the surrogate, sorry, how much do you know about your health condition? How much do you know about your father's health condition? He will start to ask to tell me about this that I have, blah blah blah. I have headache, I have, and I go to my GP and tell me for some investigations, and I'm waiting for the result. Okay, he will tell me here the story. Next, we have to think expectation and concern. What is this? Do you have any expectation? Uh, and do you have any concern? Here there is a trick, okay? I am not that one that I much like this way because of certain things. First, most of candidates they ask, do you have an expectation? The surrogate will tell you, well, doctor, I expect that I have a cancer. Okay. Then the candidate will ask you, do you have any concern? Well, I am concerned that I may have a cancer. Then the candidate will start to just, well, I have the result of your investigation in my hand, and it shows that you have blah 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 blah. What happened here? He didn't answer the surrogate. You now are not listening to the surrogate. I am telling you, doctor, I expected that I have a cancer. What is your answer for this? You didn't answer me. You just let me and ask me another questions. And I tell you I concerned about something, and you just let me and answer, ask me another questions. This is bad impression. You need to listen to him. If you ask, answer. My role here is an expectation concern. If you ask, answer. Okay, the concern is not very important here because you will already ask him about concern. What about expectation? Can I skip it? Yes, it's not thing to it's not mandatory to expect this. However, if you have this a breaking bad news, like the patient now you will giving him the news that he has a cancer. Okay, so you need to ask him about expectation. It's very important to know if he has this expectation, or he may expect that he has a simple thing. So to prepare him for this bad news. Okay, so now I make introduction. Hello, I'm Dr. Muhammad, a doctor in the clinic today. Am I talking to Mr. Ahmad Ali, 65 years old? We are here to talk about your health condition. Is it okay with you? Can you tell me how much do you know about your health condition? Do you have any expectation? Do you have any concern? Then we will go for what? We will go for the stem. Let me skip the stem or the main issue, and just after this we will talk about it. Yes, the end. We will have this stem, mean the main issue. But after the stem, we will have like concern. Ask about his concern, okay? And then we will summarize all that we have and then ask for recap and support, okay? So this is the end. What about the stem? This is the main issue. This is your main task in the system. After I give the introduction, the patient will give me some information, and then I will start to explain for him. So the first is explanation. Explain what? Explain the new diagnosis. Your task is this patient has MS, and you need to explain for him this MS. So I will start to explain what is this MS, what is the definition of MS, what is the pathophysiology, what is the symptoms, what is the complication of it. Okay. Then I will ask about what? I will ask about Jesse SAD or Jess SAD. What is this? First, J for job. Job, what do you do for living? Okay. This is very important. Why? Because after this, I will ask about the impact. How this, whatever the disease that he have, affect his daily life routine and his job. Okay, is this important? Yes. Anything, any scenario, you have to ask about the impact, even station. In the long clinical consultation or communication, you need to ask about the impact. It's very important, and this one point of communication. Okay. Okay, so I ask about his job, the impact, and then the social. What is the social? The social is that with whom are you living? Is there any dependent on him? Who is taking care of him? Or if he is taking care of someone? Are you financially supported? Okay. All of these are social. Okay, I have problem with this. I will refer to social worker. Who are the social worker? Those are the patient, the people that they may, uh, have may help him in financial support, guide him if he can apply for any payment for anything to help him. They can offer him any if he need any care, if he how he will take care, so these issues, the social issue. Okay, let's return to the job. The job, if he has a problem in his job, I will refer him to the occupational health care worker. The occupational health care worker, they are people that helping him in his work, so he can give, any benefits, any help from his work. Of course, if it's public, not private. Sorry, yes, public. Okay. I mean, it's he is not working on his own. If he is working on his own, we can't provide. But if he is working for any employer, we can provide him, or they can help him to have like insurance or anything else. Okay. Okay. What about the job again? What's important in some situation, in some stations like epilepsy, you need to ask about the job because he is engineer, he is in height, so it will interfere with this. So we need to ask about to change his job, or the way he work. Like some stations presented with firefighter and he get asthma, so we need now to change his job, how we will dealing with this station. Like chef with allergy from peanuts. Okay, this is very important to ask about the job. Then sad. What is sad? Smoking, alcohol, driving. We used to use this, jasad. But because of you have now 10 minutes, because of 10 minutes, you need to now adjust. Jesse, this job impact social is for all patients you need to ask about. Okay, what about if the patient is dead or he is about to dying? Why I should ask about any social now? Because of the family, because of the carer, because of the dependent. Okay, they, if anyone need help, you are not dealing with the patient only, you need with the whole family. Okay. Okay, after this we will sad. What is this sad? Smoking, alcohol, driving. What is smoking? We need to ask, do you smoke? Yes, doctor. How much cigarette per day? For how long? Well, doctor, it's 10 cigarette per day for 10 years. Well, smoking is very harmful for your health. I'd like to advise you to stop smoking, and I can guide you to smoking cessation clinic. Here, this is the rule. But what if the condition is like he has COPD or he has something that ischemic heart disease? This is now I need to add another sentence. What is this? That it's dangerous for your health, for your condition, especially not on general for health. No, it will worsen your condition. Okay, so if the disease that I am dealing with affected by smoking, I need to mention that I now want you to stop smoking or need from you to stop smoking, not just for your health, but also because your condition. Next, the alcohol. The alcohol. How do you drink alcohol? Yes, doctor. How many units per week? Okay. Do you have any idea about units? Or you can ask him how much. Okay. Sometimes he may tell you within limits, doctor. Do you have the limits? Yes, 10 units per week. Sometimes no, he will tell you I have a glass every week. What about glasses? There is a chart that you can find how many a cup and equal how many units. Okay, it's not to exceed 14 units per week. Um, so sometimes they may tell you the units itself, but check before you ask him about this. Okay, and don't ask him, do you drink? Or do you drink alcohol? Because he may drink anything else. Okay. So the next is driving. What is this driving? We have this DVLA. DVLA. This is the agency that's responsible for driving. Okay. Um, this driving issue, there are important, important scenarios that we use driving. Mainly the eye. If the patient has problem with the eye, neurocardio. This is the main issues. If he has, a stroke, he need to stop driving for how much, and he need to notify DVLA or no. Okay, if he has epilepsy, if he has a problem with his eye vision, if he has problem with the heart, all of these, there would be like a table. It's present in the telegram also, that will deal with this. Then the 4Bs, this is for female issue. If you have a female and you are dealing with, a disease or medication, something like this, so you need to know if she is pregnant, if she has period, if she is using oral contraceptive pills or no. So what are the 4Ps? Let's imagine she is a female and now she get a period, and after the period she get pregnancy, but she aborted and she is using oral contraceptive pills. Okay, these are the 4Ps. It's used oral contraceptive pills, but when you ask it oral contraceptive measures, because she may use any other, not only the pills. And then the management plan. I have now the MS. How we can manage you? We will give you a medication. We will give you a procedure. We will give you anything, investigation, whatever I want to discuss with the patient. I will tell. But what mostly we forget, and what are the very important, and they like the non-pharmacological. Don't forget about the non-pharmacological. If the patient is like he getting epilepsy, so I need to advise him about his job, about the driving, about his hobbies. Okay, if he is swimming, if he is, you know, um, doing any cycling. So this is a risk. Maybe something else like he is like Hokum, and he is getting palpitation. So I need to ask about any exercise, any part job. He may play gym. He may do any exercise that may increase his risk. Okay, so this is a non-pharmacological issues. Maybe according to your station and the station, you will find a lot of non-pharmacological issue to discuss, like infection. I will tell him that I will treat you, isolate you, but I need to make notification, contact tracing. I may need to anything. Okay, so don't miss the non-pharmacological. Okay. So after this, I will finish my task, and then I will ask the patient, "Do you have any concern?" No. So I will summarize. We talked today about 1, 2, 3, 4. Okay. After this, I will ask him again. Do you have any further concern? We will say, or if he ask me a concern, I will answer, and then I may ask you to recap to tell me again. Okay. Recap is not, it's okay in all stations, but if angry patient, if the patient is already died, if it's, something that about organ donation, about DNR, something that, terrible, it's not recommended to recap. And then support, that we are here to support. I can provide you with leaflet, with websites to read about it. I can provide you with the contact number of the hospital, not yours. Okay. So we do it. Okay. So we finish this approach. What is the stem? If we have the stem, what about the scenarios that you have in this communication? What it's about? You have the patient, you examine the patient, and then now you're telling the diagnosis. So it's about diagnosis. New diagnosis may be uncertain or delayed or wrong. You may have the suggestion that the patient has HOCM, a genetic disease. You may have MS, immune disease. You may have MRSA, infection. He may have like lymphoma. He may like have um, conversion or somatization disorder. Okay, he may have HIV, and there is a scenario that needle-stick injury. It's common. Okay, so this is a new diagnosis. How you deal with this? Then uncertainty. He may give you a scenario this. We have this patient. He has chest pain, but we are uncertain about his diagnosis. He may have MRI or no. So what we can do for this, that we need to do more investigation. This is uncertain. We still not know exactly what you have. So we need for more investigations. Okay. What about delayed diagnosis? Delayed diagnosis, it means like a patient is celiac and he having this diarrhea for about 2 years, and the GB always give him only some medication. He didn't ask for anything, and then now he discovers that he is celiac. Okay, so he is delayed. He is delayed for how long, and how I deal with this delayed scenario. Okay, mostly it will be we need to investigate what happened before, what happened with GB. We can investigate the records, your records. We don't know exactly what happened, so we will investigate. Okay. Then, if it's wrong diagnosis, this is a medical error. There is something called a medical error. This is responsible for only anything wrong. You may have wrong diagnosis. You may have wrong give the medication, wrong medication, do wrong procedures, make anything wrong to the patient. How you can deal with this? Okay. Then. The other issue after this diagnosis, you may have what you may give them after you diagnose the patient. You will may ask about tests. You're still uncertain, you need another test. Okay, or you may give him a drug medications, or you may need to do a procedure for him. So how I deal with this? How I deal with new medications, new procedures, new tests, or I may uh, give him wrong medication, wrong procedures. Okay, what if the patient refusing the medication or the procedure? The main issue is why he refused. Okay, and the second thing is to assess the capacity. We will talk about it. Okay, what about the compliant? He is not compliant. Why he is not compliant, and try to solve it. Okay. What about is he demanding? He is now demanding you to give him some medication or to do for him some investigation. I having headache. I want you to do CT. Does he have the right? No. Should I confront with the patient? No. I will just try to discuss the issue with him. What is the problem here? Why you shouldn't need? You are not. You don't need the CT now. What is the hazard of CT? And try to convince him as much as possible. If he is not convinced, try to arrange a meeting with your consultant, but don't confront with him. Okay. Then there are the end of life issues. The end of life issue, like dementia, delirium. This is the scenarios about delirium, dementia. How you deal with this patient. This patient is agitated. How I deal with agitation. How I feed him. How I give him medication now. How to take care of him. The risk of fall. All of this in how to take about the dementia or delirium patient. Then the palliative care, the main issue is the palliative care, how you deal with these scenarios of palliative care and palliative care with procedures, end of life issue, withdrawing treatment. All of this is all of about palliative care, how to be, what are these issues about, and what are the components that I should discuss with the patient. And the most important that it's not only the symptoms or the medical. You may need to concentrate on the social, psychological aspect, spiritual aspect, all of this issue. And then there are scenarios of DNR. It's like, like the palliative care. This patient, we decided to not resuscitate. So how I can discuss this with a surrogate or with the relative of the patient, whatever. Organ donation. It's now there is opt-out system in UK. Any patient above 18 and they spent 1 year in UK, he is for organ donation. Organization scenario doesn't appear for about since this opt-out system, it didn't appear in the basis, okay, because they need to stabilize the system before they started to introduce these in basis. But whatever the scenario is, it in opt-out system or even the other system in any system, organization, you will need to discuss with the patient for sorry for the relative for this organization. The main issue or the main problem here is that the relative will refuse mostly. Okay, so shall we do this organ donation or no? No. We will refer to the consultant, and the consultant will refer for legal court, for legal help, for legal issue, but we will not proceed for him. I will not tell the patient that he is not for this, so I will go for this organ donation. No, we can't. Okay, even in the previous scenarios before, they will can give you a patient with a donation card. Okay, and you can't take you can't make this organ donation even with even if the patient has this card. Okay, because this is like a famous story in UK that they have the relative refused for this organ donation, and then the doctors proceed for him. They complain to the court, and then the court makes the NHS to pay billions of dollars, sorry, for you of sterling to this patient, okay, to his relative. Then the postmortem examination, it's hospital or coroner that we need after the patient he is dying. Either the hospital, we are the doctors or the consultant want to know what happened. So we need for hospital postmortem examination. So we need consent from the relatives. But coroner, this is something legal. It has certain indications when I ask for coroner postmortem, and it's not. I don't need any consent from the relative. Okay, this is the main like the scenarios, the community scenarios. Of course there may be some added scenarios, but these are the main issues. Okay, the other issue here is the hidden agenda. What is the hidden agenda? This is you mean the in any scenario there is hidden something. Mostly you will find it in this just sad for peace. I mean, I have a patient with a stroke. Okay, I will discuss with him stroke and something like this. But when you ask about occupation, you will discover that he is a driver. So the driver and the stroke it's different from normal patient. Okay, this patient is having asthma, and you discover in the incubation that he is firefighter. And this person has allergy, and you discover that he is chef. This person is has a pneumothorax, and he is pilot. So the incubation, don't forget about it. Of course, because of to ask about help if he need help, but also for this issues. Maybe you need to reallocate him, change his job, and if you face this problem with changing job, it's very important to ask about what to ask about the social, because you need to offer him support. You need to ask about if there is any dependent on him. You need if he has another source of money, financial support or no. Okay, because now you are telling him that you need to change your job. He may he may can't he may unable now to change. And also for this like epilepsy, okay, you need to adjust his job and hobbies, especially in something like epilepsy, hokum, pneumothorax and scuba diving hobbies. So ask about any condition, any hobbies. Okay, what about the impact? We said that's very important in any station in communication skills. Social, we already discussed about this socials that we either for financial care, if you need any carer, any dependent, and also sometimes social is very important in what infection. Okay, if you have this infection, you need to ask about with whom he is living and for contact tracing. Okay, so this is the social. Smoking and alcohol we discussed. Driving. Driving we say DVLA type 1, type 2, type 1. It's a car or motorcycle, type 2, bus and lorry and others. Taxi is, let's say it's type 2, okay? Because taxi is as a private, they consider it type 1, but in some, like Scotland, they consider it a type 2. So if you did with a taxi driver, mostly, let's say the type 2. uh, Pregnancy. We discussed if you have this management, any medication, because she may be pregnant, and you now will tell her that we need this medication for you. I have MS, and okay, doctor, so I am pregnant. Or what about if I have any problem with pregnancy? Can I have kids or no? Okay, so you need to ask about it if she is female. And public interest, this is in infection, to ask about to tell him that about notification and contact tracing. And sexual relation, if you have like HIV patient or sexually transmitted disease, I need to ask about sexual history, and if he has a partner, and I advise him about safe sex. So it's important to mention it. How I know it? It's like we can collect it in this GIS, SAD, and 4Bs, and maybe added according to your station. Okay. How you, let's skip this. Okay. How you judgment. What is how the examiners judge you in this station? This is like the mark sheet that you will find in the real one. They judge you in 4 items: communication, clinical judgment, concern, and welfare. What is this communication? I need the candidate to be fluent. He is not saying jargon. If you say one or two jargon, okay, but three or more, no. They will deduct mark from you. And memorize or tell the surrogate all the important information. Don't miss information, because if you miss information, they will deduct 1 mark. Impact, ask about the impact of the disease or the problem on the patient. Empathy, sympathy, to be very empathy with the patient, okay? And involve the patient in the management. I mean, you will discuss with him the management plan that we need you to quit smoking. What do you think about this? Okay. I need from you to have safe sex. What do you think about this? I need to you to cut down or to moderate your alcohol, to so the management that you already discuss with the patient, involve him in this. They ask about his opinion. What do you think about this? Okay. Then the clinical judgment. The clinical judgment, it's mean on your management, all in the management plan. Like you did for him this non-pharmacological advice, this pharmacological treatment you discuss with him clearly, and if there is any ethical problem, you deal with this ethical problem, and if there is legal problem, you deal with it. Of course, for UK now there is no questions with the examiners. They used to ask about this ethical and legal issue. Now it's not, but they may ask you in this like a concern. I have this MS, and I want to. I will tell you, okay, doctor. So is it? It can be transmitted to my kids. What about my pregnancy? I now ask you about clinical issues, okay? Then I want to tell you like anything that I ask about. I want to know about. I don't want anyone to know about my condition. This is confidentiality. No, doctor, I don't want this medication, so I need to assess capacity. This is capacity. This is legal issue. Okay, so you can put this ethical and legal issue as a concern while you are dealing with the patient. That's why it's very important to listen to the concern of the patient, because when they ask you a concern, the examiner waiting for your answer to assess your concern and clinical judgment. Okay, so the concern is very important. It takes 4 marks alone. This for to answer all the concern, and it's a very bad point to miss a concern with a surrogate. Okay, it's very bad. So listen to the surrogate carefully and answer all his concern, and don't forget that he may give you more than one question in one concern. Okay. What about the welfare? Welfare that you make the patient feel comfort. You didn't give you weren't judgmental on him. You didn't give him this idea that that's your fault, or you are don't thinking well, or something like this. You deal with him very professionally and safe. The safety, it meaning you didn't give him anything wrong, and the safety will be assessed like driving also in the safety. If he is taking any medications that giving him problem, stop it. This is the safety issue. Okay. Okay. So this is about mainly the communication stage. Uh, the rest is it's very important for Irish people, especially UK. You need to listen to it because to understand what is it about. Because as I told you that this ethical and legal issue, they may ask you inside the concern. What are the ethical issues? The ethical issues are for autonomy, beneficence, maleficence, and justice. What is this autonomy? Autonomy is the right of the patient to know his disease, know the diagnosis of his disease, explain to it, and what medication he will have, or what procedure, what he will have. So he need to be knowing about all the things. Okay, this is the autonomy. Beneficence to do all the benefit for the patient. We give him this medication in his best interest. Okay, we do this for his interest. Non-maleficence, non-maleficence, not to harm the patient, not to give him something that will harm him. Okay, he wants something, but it will be harmful for him, or we choose something and to benefit him, and this thing, if we do another thing, it will may cost him a lot of harmful things, so we will not do this. And justice, that we treat all the patients equally, regardless the race, religion, sex, nationality, whatever. Okay, all are equal. This is the ethical issue. What about the legal issue? The legal issue. The main things is the confidentiality. What is the confidentiality? The confidentiality is that all the health condition of the patient, it's confidential to him. So we can't inform anyone else about his health condition. Okay, until he gives us the permission. This is the confidentiality. Let's talk about this confidentiality. It's for about person 18 years old or more. Okay, so any person with 18 years old or more, he has the confidentiality. What if he is 16 or 14? There is, here you need to assess the capacity of the patient, and to be sure that he is independent, he can work, he can take decisions. Why I'm saying this? Because this is a scenario that patient he is like 16 or 17 years old and he got epilepsy with uh, ecstasy, and he didn't want you to tell his mother. This is a scenario, okay, a famous scenario. So here the issue is that he is 17, but he is independent and he is having the capacity. So you can tell his mother about all the information that he didn't give you permission for this. Okay, so this is a confidentiality. Okay, so when I could breach this confidentiality, if he giving me a consent. Okay, if he lack capacity, I mean he loss of consciousness. The patient now, he is loss of conscious, he is on ICU, I need to talk to his relatives, so I will breach his confidentiality now. Or he is lacking the capacity, like he is severe delirium, in severe dementia, he can't, we assess him and he can't take a decision, so we need to talk about with other. Okay, okay, if it's required by law or court, or if it's like we are talking like medical staff, I am a doctor, the chest doctor and the neuro doctor, we are talking about the patient condition. This is not this is our right to breach his confidentiality and talk about his condition. Okay, or the public interest. What's the public interest? I mean, there is hazard to the people outside in the community, especially if there is infection, and this is a notifiable disease, or for DVLA if there is a driving issue and he didn't want to stop driving, he may be hazard for the public. So I need to inform the DVLA. If he refuses, I should ask for him. Okay, and also the suicide risk if there is suicide. Okay, let's talk about this a little. Infection, if he has meningitis, I should notify. If she has any infection, I should notify. He may tell you, no, I don't want anyone to know. Okay, we will not confront with him, but we will tell him that's very dangerous, and the sole fear is that it will be anonymous. We will not tell your name, just we will inform that there is a case of what. Okay, this is one. What about DVLA? DVLA is a patient, he is like having stroke, and we advise him, or having problem with his vision, we advise him to stop driving and inform DVLA. And then he tell me that I can't inform DVLA, I will not inform. I will try to convince him as much as possible. I may, and at last, if the scenario, usually the scenario will he will agree. Okay, if there is a new scenario and the patient is disagree with DVLA, I will trying to tell him again and again that's better, and I will discuss all with him all the advantage and disadvantage of this decision, and then we'll tell him that I need to check with you again, and I'm sorry that if you will not inform them, I will be, have this eligibility to inform them. But keep it in the last if the scenario is with this. Okay, if he accept from the start, okay, but not from the start to confront with him that no, you should tell. I will tell them if you don't know. Try to convince him. Try to do all your effort. Then do this. Okay. What about this suicidal risk? In suicidal scenarios, you will have this patient and she gets this suicidal attack. Um, she will tell you that I will not, I don't want to tell my GP. I don't want to tell my family. Okay, so you don't need to tell her family. What about GB? GB, you don't tell her GB unless there is a a suicidal risk. You mean there is a risk that she may return to suicide again. Here you can tell GB about this suicidal risk that she have may attend risk of suicide again. Okay. So usually, if you ask not to breach her confidentiality, it's okay. We will not breach it, but we will need for after assessment your condition, and we will discuss this more after assessing it. Because already in suicidal scenarios, we need to retain it under mental act at least 72 hours to be assessed by a psychiatrist. Okay. Okay. Okay, keep it. The last thing in today, let's talk about this capacity. What is this capacity? Capacity, is the patient able to take a decision or not? When to assess capacity? Usually, when the patient reviews something, I give him diagnosis of MS and I tell him that you need this medication, but he refuses it, or he wants to discharge against medical advice, or in suicide. Okay, then he will need for me that to assess the capacity of this patient. How I assess? There is four things: are with, understand, retain, weigh, decide. Understand. I mean to assess that he is understanding what I am saying to him. Okay, so and then I need to understand that he retains the information, he understand it and keep it. Okay, and then he can weigh between the benefits and the cost. He can weigh between the advantage and disadvantage, and he can decide this his decision. Okay, how I do this? This is a mental capacity act. Okay, how I do this? Just by simple things. I will take my scenario as it, and then I will start to explain to him. Like your condition is blah 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 blah. Are you following me? Do you get me? Is that clear? So I check his understanding. Then the retain. I realize that I have given you a lot of information. Would you tell me what you get so far? So now he like recap or he summarize for me. Then I will ask about how do you feel about this? What about the advantage and disadvantage? And I will ask if he decided or not. Okay? Taking consideration sometimes the patient he is dementia. That means not he is losing capacity. So even in dementia patient, I mean if the scenario is a dementia patient with dementia and we want for him to do a pacemaker. Okay, so I now assume that he is losing capacity, so we can't give him the pacemaker and we can put it without his consent. No, even if he has dementia, I need to assess his capacity, okay? Because he may not losing the capacity even with this dementia, okay? And I should differentiate between the patient he losing capacity or he is uncooperative, okay? Or something that may affect him, like he is in pain, he is fatigued, he is in shock, whatever it, okay? And when I assess this capacity, I need to maintain his confidentiality. I document it and review. I mean, I talk with the patient now and I feel that he is losing capacity. After 1 or 2 days, I will reassess him again to recheck that he is still losing capacity or no. Maybe he is in pain when I was talking with him the first time, or he may be wasing angry, uncooperative. Okay, so I need to review it. So the mean for basis wise, what I need to you when I took the patient to give him these four questions. Are you following me? Do you get me? About understanding. I realize that you have given a lot of information. Would you tell me what you get so far? This is for retaining. Well, how do you feel about it? Okay. And what do you reach any decision or no? Okay. This is the capacity. Let's say this is for today. We have this advanced directive. We can discuss another. This is are the legal. What are the legal? If I want to discuss with you this confidentiality, capacity, the consent before the procedure. If taking procedure or something like this, I need to for him to take a consent. DVLA, this is driving. We have this like advanced directive, advanced assessment, LBA. We will discuss later. May have a problem like medical error and if there is complaint. Patient is asbestos and he asking for compensation. Patient refusing DNR. What about withdrawing treatment if he refuse? What about organ donation and post-mortem? Okay, this is for today. These are the main or the basic things that communication skill in our course. We will deal with all these like scenarios step by step. We will deal with this diagnosis, how to reach if you have all diagnoses, genetic, immune, infection, malignancy, functional, HIV, how to deal with this. And after this, we will discuss how to discuss diagnosis with medication or diagnosis with procedure, and how, of course, how to deal with patient if he refuse, if he is non-compliant, if he demanding anything. Then these end of life issues like dementia, palliative care with procedures, end of life issue, treatment withdrawing, DNR, organ donation, post mortem, and of course we will deal with medical error and complication. All of these are the content of the course that will be like 8 days. We will discuss the issues and make like a mock scenario with the feedback, like this mark sheet here. I hope you enjoy this, and I will provide some links below the video. Thank you.